What are the myths associated with hospice care? Hello there, and I hope you are doing well. As we explore these difficult subjects of life, hospice care is misunderstood, and many people refuse to get hospice care because of myths. Myths mean they are not true, they are things that have been talked, have been said. There's fears involved in signing up for hospice services, and hospice does not bring death. Death is going to happen to all of us. So, hospice doesn't come to quicken death. And it's important to know what some of these myths that keep people from receiving help and care that is available to them. One of them is that people are afraid of the cost. Hospice care must cost a lot because there's medications involved. There is people coming to visit, nurses, even doctors, even personal care attendants, CNA. So it must cost a lot of money. That's a myth because hospice is a free service provided by Medicare and Medicaid. It's paid for and it comes to you, to your loved one at a free cost. And it brings a lot of benefits because when someone qualifies for hospice care, all of the medications related to comfort care are covered under hospice care. In a country like Kenya, where hospice is very young, it's not incorporated in the medical field. It's provided by charitable organizations. Unfortunately, countries in Africa like Kenya, unfortunately, the hospitals are out to make as much money as they can out of people to the very last moment. I have witnessed this with friends, but more importantly, I have witnessed it with my own mother. It's very sad because the hospitals there in Kenya, they don't even tell people you're terminal, or they don't have any services to advise people what happens when somebody is terminally ill. What can they do? They don't advise people, they don't support people. There's nothing there to support people. So, for those that are even lucky to be told there's nothing else that can be done, they don't know what to do next. It's up to them. So, but there's hospice services that are available in Kenya. It's volunteer work. It's charitable, and so it's still very new and very limited. But those who qualify, they get services, they get medications through these organizations that are very expensive otherwise and unaffordable for most people. So, hospice care is not expensive so that people just decide, I'm not even gonna bother to check into it because I don't have the money. Please try, call, get assessment, and find out what is available for you because there's a lot that is available for people and people don't know it. They go without it. Another myth is that hospice is for the elderly. It's only old people who get hospice services. The fact is, hospice services can be received by anybody of any age that qualifies for it. So again, it's not a negative thing to get hospice services when doctors say you need to call hospice and try. Please do, because hospice comes with a lot of services, even for the young, for the adults who qualify. Hospice comes to help. And so many people go without extremely good help because of myths that have been spoken to them. As a matter of fact, hospice is not just for old people, because there is a lot of old people that don't qualify for hospice. People don't get on hospice because they are old. I've seen 100-year-olds trying to get into hospice and they don't qualify because they are doing great. Nothing says they are gonna die any soon. So hospice care is not just for the old because of age. It's not given because of any age. It's given because of conditions. Another myth is that a hospice when you come to hospice care, you stop all treatment, and that's not true. Hospice care actually provides treatment. It provides pain management, provides anxiety management. It helps with antibiotics. If somebody has infections, they can have antibiotics. So there is treatment that goes along with hospice care. However, it's not the curative treatment. That's the difference. So it's not like you're gonna get on hospice and you must stop taking all of your medication. Again, get evaluation, because there's many people that are not benefiting from hospice care because of myths. Another myth that scare people a lot is, we all know you develop a relationship with your primary doctor. You trust your primary doctor, you trust your primary care. And there are people that think once you get on hospice, you must stop seeing your primary doctor. You don't have to stop seeing your primary doctor. You can continue to see your primary doctor. However, you must be assessed by the hospice doctors. And what happens is, when you are on hospice, the hospice doctors manage your care. However, if you want to continue to see your primary doctor, you can, and they communicate. Here's what happens. Most people think you must stop. You don't have to stop. What happens is, when people sign up for hospice, over time they start to trust the hospice team, and they start to understand how it all works. And many people, of their own account, end up giving up on seeing their primary doctor, because over time they realize it doesn't make sense, but they are not forced to. So don't be afraid to sign up for hospice because you think you will not be allowed to see your primary doctor, or to sign up your loved one because you think that you will not be able to see your doctor. Another one is, there are people who think when you get to hospice care, you must sign a DNI consent to say, do not resuscitate me, do not intubate me. And there are people who think once you sign up for hospice care, you absolutely have to sign saying that you do not want to be resuscitated. And that's not true. We have many people who come to hospice and they don't sign their DNR. So that should not hinder you from seeking to get on hospice services. Many people sign DNR because what happens is people get a lot of education. And when people are educated on a subject, on a condition, it's not the same as when people are not educated. So what happens is when people get on hospice services, they get a lot of education on their condition, on the prognosis, the disease. They also get a lot of education on what resuscitation means, what it takes, what it does. And when people get very good understanding of everything, we see many people signing DNR. You don't have to. There are people who don't. So I'm going to leave that at that. Seek hospice care and get evaluation and get education. We don't make decisions for people. People make their own decisions. Some people sign up for, well, it's rare. It's rare. Most people who sign up for hospice keep it. There are people who sign up for hospice and they start to thrive. They start to do so well. And all of a sudden, there is no need to keep them on hospice services. And so they are getting discharged. And we see families begging to not be discharged. We see patients begging to not be discharged. Because when people get on hospice and they start to receive the services and they realize how advantageous it is, people don't want to sign off. That's how good hospice care is. People who have tasted it, they don't want to sign off. They want to stay on. So you can sign up for hospice. We see people who sign up and then they are told there's a trial medication and they revoke. So, and I mean, there's a difference between revoking and being discharged. Discharge is is done by the hospice. It's when the hospice doctor, the hospice team says someone doesn't qualify for hospice care, or if somebody needs to be admitted for certain things, then they are discharged because they cannot be on hospice at the same time receiving cares at the hospital. Revoking is when the family decides we want to come off of hospice. So that's called revoking, and families revoke all the time because of various reasons. We don't get mad at them, we don't get upset. Hospice is not something that comes to make a profit off of people. Hospice comes to help. So we are not mad at people because they decided to sign off. We don't hold people hostage. People can come on and come off and come back on, and we're always there. We're not gonna be like, oh, you signed off, so forget you. No, we walk the journey. We wanna help people make the best decisions for themselves during that time. So the myth that there's retaliation with, we don't come to do our will, we come to walk the journey. Another myth that is really a sad one is when people think that hospice is provided only during the last week of life. And so there are people who push hospice care off until the last week until their loved ones stop eating. And that's when they call hospice. And then hospice care comes and evaluate and mate, and then they realize how much they missed out. So don't wait for the last. As soon as the doctor says, check out hospice, please call hospice and get evaluated. There are people who benefit from hospice care for a year, for 2 years. Because when people get admitted for hospice, the expectation is that they have only 6 months or less to live. But that is based on studies and experience. Based on diseases behave differently for some people. And so some people end up living longer than the 6 months. I have personally seen people live even up to 3 years receiving hospice services and support. So don't wait for the last week. Sign up as soon as you possibly can because it's very beneficial. It's very beneficial for your loved one, for your family. It is very beneficial. By the way, for people that need incontinent products where there is leaking of urine or people can't control their bladder or bowels, that the depends are provided free under hospice care. So instead of buying, and those things are expensive. So there's a lot of benefits that come with hospice services. Sign up as soon as you possibly can. It's out there, it's underused. It's very underused because of myths. Another myth is that hospice is only for cancer patients. That's a myth. Hospice, you don't even have to have a terminal disease to be admitted on hospice. It's not only for cancer patients. I know in Kenya, for the hospice team that I have talked with, for a long time, they only admitted cancer patients. However, that has also changed, even for that organization. So, hospice care is not available only to cancer patients. It's available to all terminal illnesses. Once the doctor says an illness is terminal, hospice is available for that. But it's also available for failure to thrive, where hospice, even family can call themselves and ask the hospice team to come and evaluate their loved one. And to many people's surprise, they qualify because there's a criteria that people are evaluated on. So again, it's not only for cancer patients. Please call a hospice organization and have them evaluate. If you have any questions or doubts, just call. They'll come and they'll check. And if your loved one doesn't qualify and the hospice team thinks they are closer or they know that you are interested, they'll keep that and they'll check down the road to see where things are. So once you introduce yourself and the hospice team knows you are out there and you're thinking about it, they'll check. They'll check back. So again, it's very advantageous. There's the myth that when people sign up for hospice care, they have given up. And so people will say, don't give up. Don't It's like signing for hospice is not equals to giving up. And that's usually said a lot. You signed for hospice, don't give up. No, signing for hospice is not a sign of giving up. You sign for hospice to get support along the journey. Signing for hospice is actually a great strength because you get a lot of benefits, a lot of support with hospice care. So, someone signing for hospice care is not a sign that they have given up. It's not equal. Again, with many Christians, I saw the biggest fight with my own mother when I signed her up for hospice. And hospice was kicked out as soon as I traveled back to United States. So people think when you invite hospice team, you have lost faith. And that's not the case. Hospice come with benefits. And unless someone take time and they are open to understand to the benefits of hospice, we lose out. Even the Bible says God's people are destroyed for lack of knowledge. Many Christians themselves are destroyed for lack of knowledge. And hospice care is not an evil service. We don't come with evil eyes to bring death. We come with loving hearts to provide care, to provide counseling, to provide support during a very difficult time. And so refusing to get hospice because you think it's a sign of no faith, actually get in and get education because it's gonna help you change your mind. I have to say, as a Christian minister, I'm ordained Christian minister, and I'm a person of faith. And the spiritual gift that has God given me, that God has given me, I don't even know what I just said. The spiritual gift that I move in the most is the gift of faith. I have the gift of faith. Um, when I touch on situations, they will usually succeed. Now, my life has not been perfect because I'm humanly imperfect, but I operate in the gift of faith. And yet, I'm a hospice chaplain, I'm a hospice worker. So I share this to say faith and hospice go together. Faith and hospice go together. As a matter of fact, people who sign up for hospice have a lot more faith than people who don't because you realize that hospice does not bring death. Accepting care doesn't mean you have given up. So, again, there's a lot to discuss when it comes to hospice, but today I'm going to focus on the myths. Hospice is not a place. That's another myth where many people refuse to get evaluated for hospice because they think that when they accept hospice services, they're going to be forced to move to a certain place, to a dying place, or to move out of their home. Hospice is not a place, it's a philosophy of care. So, hospice will come to your home. As a hospice chaplain, I've traveled to all kinds of people's homes, to all kinds of nursing homes, even in certain situations to the hospitals. So hospice team comes where the patient is. You don't have to move anywhere. So don't be afraid to be evaluated because you think that means you must move out of your home. As a matter of fact, signing up for hospice helps very many people die in their own home because you are receiving support, you are receiving services, you are receiving a lot of resources that can help you peacefully die in your own home. Because I'm a hospice chaplain, I helped my mother die in her own home. That was her wish. And the family was not on board. The family was fighting it. They wanted her in the hospital all the time because they thought the hospital could keep her from dying. My mother knew she was dying, and I knew she was dying. And so I worked the hardest, even against my own family, to help my mother's wishes come true. And during that journey, my family viewed me as an evil person. I share this because there is many people who think hospice people are evil people. Hospice people are kind-hearted people like me. I'm a very kind-hearted person. I help so many people any way I can. And I love me because I love to see people succeed. I'm not threatened by other people's success. That's why I educate children. I want them to do better than me. I'm not afraid of people succeeding and doing better than me. I celebrate people when they succeed. That's me. That's the heart of this woman. But yet I'm a hospice worker. Where people think hospice workers are evil people who don't care. It's a myth and it's a lie. Hospice people are very loving people who deeply care. That's why we come during the most difficult time of people's lives, and we come. So, my own mother, yes, I helped her die in her home. That was her wish. That's what she requested me to do. That and a lot of prayer, depending on Holy Spirit and listening to Holy Spirit promptings. I helped my mother die in her home, a very peaceful death, surrounded by her family. And what that proved to me is that it can be done. So in Kenya, when I went and I was trying to educate people, family, and first they were saying, this is not a Kenyan thing. This is an American thing. Don't bring American things to us in Kenya. I had doctors surround an entire room as I was asking questions concerning my mother's mortality, what can be done for her to die at home. And doctors, cardiologists, they said, we've never had anything like this. Nobody has ever asked us this type of questions. Why? Because death is avoided. Let's not talk about it. If we don't talk about it, it's not going to happen. No. Death is going to happen. Whether you talk about it or not, death is going to happen. So it's better to talk about it and handle it with grace. So, what my mom's situation proved to me is that it can be done even in Kenya. My mother and her family surrounding her when she was taking her last breath. Her family was surrounding her, praying for her, talking with her, loving on her. If she was in the hospital in Kenya, that was her experience. And my witness and experience is they don't allow family members there. A family member is allowed 1 hour lunchtime, 1 hour dinner time, and that's it. The rest of 247, that your loved one is in a ward by themselves. Sometimes my mother could need help in those hospitals and there was nobody to help her. That's how she could have died. And that was her biggest fear because she went through so much in those hospitals. So, what that proved to me is that it can be done. And that is my quest today, is to fight for families to be educated on how to care for their loved ones at home. With education and the right support, we can take care of our loved ones at home. Another thing that I've seen in Kenya is where they keep the patient in the hospital for no reason. They know that they are not really doing anything to keep the person alive, but they'll put them in ventilators, they'll do all these expensive treatments just to make money out of the family. And the family is raising millions of Kenya shillings to pay for nothing, really, to pay for nothing. My mother died at home. We didn't have a hospital bill when my mother died because she died in her home. No hospital bill. And this can be the case. Families in Kenya, they are selling their land to give to hospitals money just to keep somebody to die in the hospital. And then when the family is not able to come up with the money, they hold the body and they refuse to release the body for burial. And so the family is now trying to raise money to pay for the hospital bill. And then every day they are keeping the body, it changes. And so now the family is also raising money to pay the funeral home or the mortuary for every day they are keeping the body. And they refuse to release the body. But they knew the person was dying. Instead of giving education to the family so that the family can care for their loved one at home, bring them. Oh, you want them in ICU? We will put them in ICU. And they know that your loved one is dying. Just to milk every dime out of even the poorest family so that they can sell land and give them and make them rich and richer. That's why I'm doing this. That's why my quest is to fight to educate as many people as possible so that people are not getting destroyed for lack of knowledge. So, all we faith people, I'm a faith person and I'm a hospice worker. Accepting hospice care is not giving up hope. It's not a lack of faith. It's, as a matter of fact, it is a sign of faith. So, those are some of the myths. Those are some of the things that are out there that cause many people to decline to receive hospice care. Again, stay tuned, stay with me as we continue to explore these subjects on how to care for our loved ones. God bless.